then, how are you doing there? Are you okay? Lovely. Can I I'm going to just manoeuvre you a little bit because I just need you in a slightly better position for me. Are you okay there? Head rested back? Wonderful, wonderful, wonderful. Right, I'm just going to pop on my mask because I am going to need to get quite close up to your face. All right? So when you last came in, was it my colleague you saw? The other leather nurse they have on? Oh, I see. She's lovely, isn't she? Don't you just find her a most wonderful, wonderful nurse to be around? She is lovely. I know. I often take my lunch breaks with her. And we'll pop out and have a little cup of tea or a little something together. And a lot of people say that the leather sounds of the leather nurse are really helpful when they're trying to relax. It can be quite nerve-wracking coming to see the doctor, can't it? Not this doctor though, not at all. Right, can I just please? Just going to give you a very quick once over, so you've nothing to worry about. Let's have a little check here. Going to be listening to your chest, all right? All right then. I'm going to get in quite close to you now. Is that all right? Just here, tapping. All right. I know the sound of my gloves on the rubber tubing is sometimes a little off-putting. All right. I'm just going to lean over here. Now, are you okay there? I'll just feel my glove pressing that down, and I'd like you to take deep breaths for me. Big deep breaths. We'll do it together. Ready? Big breath in. Hold it for me. Keep holding. You can breathe that one out. Alright, I'm just going to have a look at the other side, please. Coming in here. Now hold that there. No talking, please. Good job. One more for me. Amazing. I'm just going to pop that in the centre. Can you give me a little cough? Just a little... Yep. And a really deep one, please. Like a real deep, hard... Big cough, please. Amazing. Right. Lovely. You pleased to hear? That's lovely and clear. Yes. Nothing to worry about there. It's all nice and clear. Not to worry. Alright. Okay, moving on, I am of course going to give you a little cranial exam across the eyes and the head, okay? So I might want to, do you mind, I'm going to just need to get quite close up to your temples actually. I'm going to pop my fingers here. You're just going to feel them rolling gently around your temples, side to side, round and round, and a small amount of pressure. I'm just going to take my fingers, just going to feel a little tight pressure, a little tight squeeze now. Just breathe for me. What does that feel like? Left side. Feels a little bit more like I'm pressing on a pressure point, right? Not a worry. Okay, are you ready? Right, we're just going to get you to follow the light for me, please. Take your time on this, there's no worry. I just want you to gently follow the light across, all right? It's quite bright. Okay, you can just follow my torch, left, and then to the right. Okay, can you do me a favour? How many fingers am I holding? Okay, if I put them back here, how many fingers am I holding? Alright, let's try that again. Left to right, please. That's it, it's going to come down and up and over. Do you see it? Okay. Alright, can you just, I'm going to put the torch on back here. Just tell me when you see a flash. Yep. How many flashes do you see? Okay, lovely. Alright, one more time. I'm going to get you to follow the light, but this time we're going to go up to the left, alright? I'm just coming in nice and closely to you. Are you okay? Alright, just look out for that light. Going up to the left. Do you see it? Follow it all the way up to the left, please. Slowly with your eyes. Keep looking left for me. Keep looking left. If you can keep pinpointing on that light, I'm just going to come in and measure pupils for a second. Yeah, that's fine. I'm going to do exactly the same on the other side, please. Follow the light up and all the way up to the right. All the way up to the right. Keep your eye on the light, please. And the light, just going to come in and do a very quick measurement there. Yeah. Okay. Alright. Okay. Alright, all done there. Now, how does that feel? Good. I'm very pleased about that. Now, I'm just going to warm my gloves up for a moment. I'm just going to check underneath your glands here. Alright? Alright, no problem at all. I need to get you to lean back a little. Right. Coming in underneath my gloves now. Check your glands on this side. Lovely job. And your glands on this side. Fantastic. Excellent job. Feels alright. Have you had any trouble sleeping at all? Okay, a little bit of sleep deprivation. That's not going to help matters. And have you had any problems with eating? Digestive issues? No. Any sudden weight loss? Weight gain? Okay. Well, I'm afraid after Christmas everyone gains a little bit of weight. So just the headaches, nothing else worrying you. Alright. Can I please ask you, in the last 6 months, has there been anything that has particularly worried you? Something that could have somehow triggered perhaps a higher level of stress than usual? No. Oh, I see. So not 6 months ago, but about 9 months ago, you lost your father. Okay. And do you feel that you were supported within that time? Okay. Well, there's not a time limit or a journey that's particularly right for anyone, and if you're still struggling with that, that's perfectly okay. Right? Perfectly okay. The trauma of losing a loved one can stay with us for a very long time. I don't want you putting pressure on yourself that you're not where you think you should be at this exact moment in time. Alright? Okay. Now, do you think you need me to put forward that you would need any extra therapies with that, or do you feel that you're coping alright? I think you are too. I think the occasional night's sleep that's interrupted is perfectly normal. Alright, what I would just suggest is you being a bit more mindful, being a little bit kinder to yourself, just taking those moments in the day that perhaps feel a little bit more highly stressed than others, and just sitting back for a minute and taking a breather. There is no shame in just taking 5 to reset ourselves. Okay? Alright. Well, other than that, I'm happy to tell you that there is nothing serious for you to worry about. I don't think we need to send you for any further tests today. Alright. Well, you go home, make yourself a lovely cup of tea, and have a good rest. I'm happy listening, my darlings.
Hello, Mr. Davis. How lovely to have you back. Yes, I do in fact have you booked in today. Let me just double check. Yes, I can see. We're actually having a small procedure today, is that correct? And how are you feeling about that? Are you ready? Do you think you're going to be ready for me to put my little hands all over you? Good. And you're calm? Excellent. You know that I'm going to numb the area, so you don't have to worry about that. No, we've spoken about a full anaesthetic, and I think that's probably a little bit over the top. I'm going to be here with you the entire time. That's right. You'll be safe in my hands. So, let's have a little look. What we're going to have to do today is going to clean the area. Yeah. We're going to have a good session just giving the area a good clean. And also what I might need to do is just take a small swab from your nose, just a small culture, just to send off to make sure there are no additional infections. So what I'm going to do is I'm going to come in very close to you now, okay? Open up. That's it. Just a big deep breath. And this is just going to, there we go. There we go. We're just going to circle that in and around. Lovely. And I'm going to send that off. Go off to be checked to make sure there was nothing else that we need to worry about. Okay. Yes. Brilliant. And you're in general good health. Lovely. Can we just do a quick check? Just a quick check on you to have a little look. Okay, I'm going to slide this up your jumper. Here we go. Sliding it up. There we are. Is that all right? Big deep breath for me. Make it a big breath. That's excellent. Sliding it down now. I'm sorry if it's a bit cold. Good job. Big cough for me. Here we go. No, better than that. Yeah, that's excellent. No, I'm not worried there at all. Not at all. So that's absolutely fine. So if you're ready, I think we can start. Okay. Come over here. Come on. I'm going to get you just to lay down here on my bed. That's it. Your head back. That's it. Bring your head down. That's it, Mr. Davis. Now I can see you very clearly, and you'll have my tender hands to keep you safe through the whole procedure. All right? Lovely. So, what we'll do, I'm just going to take a small amount of this numbing gel. There you go, Mr. Davis. There's a small amount. I'm going to rub that on the area. That's lovely. Let's get that all rubbed in. Yeah, that's good. Give that a moment to work. And then just a small prick. It'll only be a tiny little needle. Okay, I'll just show you the needle top. It's just a tiny one. There you are. Just going to put that into the syringe. All right. We're just going to give you a very small little needle prick now. That's it, all done. Just a scratch. Lovely. Now, you talk me through what you've been up to recently while we're just waiting for that area to become completely numb. A new car. Lovely. Yeah. You're a speed freak. Well, I can tell because I see you in here every 5 minutes. Okay. You're starting to feel anxious. Oh, Mr. Davis. Let me stroke your head for you a little. How could you feel anxiety when you have me here? Come on. There we go. Now, are you ready? Right, relax back for me, please. And I'm just going to make a very small incision, okay? It's not the nicest of noises, but it's fine. It will be over in no time. Okay, you ready? Here it is. There we go, that's it. That's the worst of it done now. And I'm just going to need to scrape away a little at this cyst, all right? So you will hear some scraping as we just separate that away. There we go. It's only the size of a pea. You'll be fine. That's it, all done. Right, let's take that out. There we go. Let's just give that a little wipe down. Oh, it's just a little spot of blood. You'll be absolutely fine. I'm just going to take my thread now. Do you see that? There you go. And the needle. And we're just going in with a couple of small butterfly stitches. That's it. Well done. Next one. You've only got 3. You'll be all right. That's 2. One more. Here we are. And that's 3. Well done. We'll just get that sorted out. Yes, that's right. Yes. And that will be a No. They will dissolve within the skin, so you won't have to come back. You wanted to come back and see me. Yes, I can kind of understand that. I do sort of get it sometimes. Anyway, back to concentrating again. Where were we? Yes, so, right. I'm just going to give that a little swab down. Let me just give that a little clean up. Little area there. Can you bring your head up towards me? Come up towards me a little. That's it. That's it. Let me just check you. You follow my finger for a second. Well done. You're fine. And you're feeling relaxed? Good. I want you to stay there for a moment. I'm just going to go through a few more checks with you. So, just take these off for a second because we won't need these for the moment. So we'll just take these off a little bit. We don't need those. And also, it's so difficult to use my computer when I've got these gloves on. Honestly, it's a real challenge. Right, there we go. Just pop those in the bin. Okay, so let's have a little look here. One moment. You like my doctor's badge? Thanks. Thanks so much. So you've had this procedure done before. It's a reoccurring thing. Okay. Honestly, I've had people come in to see me many times, but they don't regrowth cysts just to come in and visit. I don't think that's possible. Medically, I don't think that's possible. Okay. Well, what we're going to do is we're going to keep an eye on that. And there is some medication I can give you that can help. But truthfully, unfortunately, with this kind of cyst, any area that becomes a little hot, a little sweaty sometimes, just one moment. That's it. Yeah, that can come a little hot and sweaty sometimes. Those are the areas that are prone to this. The pores fill and they tend to get infected. So I do want you to take extra care when washing. Keep those areas nice and dry. Maybe some baby powder even. That can help. But unfortunately, if you're prone to it, it is just one of those things. And it is such a minor procedure. You can always pop back if you feel you need to see me again. I do enjoy seeing you, definitely. So let me book you in for a regular checkup. If you don't mind, I'm just going to take my mask off. Don't really need that right now, do we? Just pop that over there. What's that? No, you're correct. I don't usually use the red lipstick, but do you know, I just felt like a change. I'm very glad you approve. That makes me very happy. Now, back to important things. I'm going to get you to come back in a couple of weeks. We'll just have a quick look at that. And also, I might want you back in for another full scan. Do you think that would be okay? Good. Good. Well, for today then, I think that's all we have. It has been the most delightful pleasure seeing you, as it always is, Mr. Davis. I'll see you very soon.
Now, as you can see, we are ready for the first procedure, but of course there's a few things I'm going to need to do first. So I will need to scrub up a little bit before we begin our procedure, because of course this is going to be a very long procedure. Very long indeed. They're my favourite, you know. When I say long, I mean from beginning to end, at least 9 months. You never know. Things might progress early. These things happen. It's not unheard of, you know, not at all. I'm just going to pop some gloves on for you. So, you were all too eager to answer my message, weren't you? Jumped straight in there, didn't you? Did you imagine that it meant you would be coming to stay with me? I don't suppose you did you? They rarely do. So foolish about these things, so foolish. Anyway, that's all right. I'm sure you'll enjoy this first part of the procedure. It's not so painful. I can't promise the rest of it won't be painful. But this bit, no pain at all. So you'll be fine, won't you? Won't you? I'm certain that you will be. Let's just pop a little cap on here. There we are. I'll just take some of that and pop it up behind. There we are. Don't want that disrupting us with our very important business, do we? Absolutely not. I'll just tuck that over my ears a bit. Okay, I'm going to do a couple of quick checks on you. I don't want any accidents happening when we're working. So, if you can just pay attention to me, well done. I'd like you to follow the light, all right? There we are. If you can just follow the light for me. Are you ready?